Well, John, this is a day, if not of first, then of staggering proportions not seen since the height of the global financial crisis. Traders said that they knew things would be bad when they saw the extent of the oil price declines overnight. So when the markets opened here, there was only really one way things could go. What was most surprising, though, was the extent of the declines, which triggered, as you mentioned there, John, what's known as these circuit breakers that automatically kick in and shut the market down. That is a very, very rare event here on Wall Street. The idea is that it gives investors a chance to stop and try and take a breath. But when the markets reopened, the screens immediately went green then, as they are now still behind me, as you can see. What's perhaps most worrying, John, is that investors really have been pricing in a global economic slowdown now for weeks because of this spreading coronavirus. What traders are now saying, though, is that the market is pricing in a full-blown recession.
At the New York Stock Exchange, it is an historic day of trading.
And fear and uncertainty is wreaking havoc.
We're looking at declines across the board. Fear in this market, there's no other way to say it.
They're calling it Black Monday. Traders in New York braced for the worst, and within seconds it came. At the open, shares plummeted to levels so low it triggered the stock exchange to automatically shut down.
This morning, there was definitely some panic in the air. Started last night when you started to see the futures trading down, and everyone was worried about where the markets were going this morning. There was panic coming through the phones, on the floor, traders just trying to rush to get to the point of sale to get rid of their stock. This was definitely in the oil markets where I think people started to fear a global recession. So you have a market that's falling out of control. You have oil markets that are falling out of control, and you have no idea with the backdrop of a virus globally where all the chips are going to lie when it's all said and done.
The latest panic came as investors here and around the world reacted to a crash in the oil markets and the onward spread of the coronavirus unchecked around the globe. As the market reopened after a 15-minute pause, Wall Street's leading share index, the S&P 500, tumbled more than 6%. Markets were already spooked by the virus and its impact on the global economy, but adding to their fears, an escalating spat between Russia and Saudi Arabia over oil prices, itself in response to a drastic fall in demand in the wake of the coronavirus. At a meeting of the major oil producers last week, the plan was to cut production to stabilize the market. But last night, Russia refused and instead ramped up production and slashed prices. Not to be outdone, Saudi Arabia quickly followed. Oil prices tumbled. That stunned the stock markets, and the rest is red ink on the screens. The US stock market followed a pattern set across the world. The FTSE in London, the DAX in Germany and the Nikkei in Japan, all tanking. Trillions wiped off the values of stocks in drops not seen on most of the world's markets since the financial crisis of 2008.
Investors, I think, are frightened of another big crisis. This is the first time that the global economy and the global markets are being tested since 2008. These are really big moves, and clearly the implications are dramatic.
The worry is the usual tools are having little effect. The dramatic cut in US interest rates last week failing to have its desired impact. As parts of northern Italy went into lockdown, in the US, similar action may be needed here. Though President Trump, who visited the Center for Disease Control on Friday, stuck to his line that the markets were simply reacting to a dose of fake news and that life and the economy go on. Well, President Trump, as you saw there, going out of his way to try and pump up the stock market and play down the threat of the coronavirus. He's even saying that the oil price declines are a good thing for consumers. Of course, they're not good for US oil producers. And he's reminding us of the numbers of people that die from the ordinary flu every year. And of course, there, as you saw, pointing the finger at journalists who he says are responsible for hyping this story and causing the markets to tank in an election election year, we know he's going to do everything he can to try and keep the economy strong. Traders here, I should say, though, are not blaming journalists. They are talking to a very real fear that all of this could lead to a global recession. They are hoping that the White House today will step in and say something to try and calm things down. We know that the Vice President Mike Pence is due to hold a press conference to update everybody in a couple of hours' time. What the traders and others are looking for is some sort of reassurance that they will offer paid leave for families who are being forced to take time off, or maybe even step up and prop up ailing industries like the airline and the travel sectors, which are being hit particularly hard. You can see from the screens behind me there that most of those stocks are very much in the red. The problem is that whatever financial assistance they provide, all of that is welcome, but what traders really want to see here is the development of a vaccine. But as we know, as we've said many times before, that is at least 6 months to a year, if not further away. Matt.
Siobhan, thanks very much indeed. Well, Katie Martin is the markets editor at the Financial Times. She's with me again now. Katie, the last time we spoke, it looked bad, but this looks a lot worse. Now, why is that? What are the underlying reasons why this is so much more serious?
Well, as you say, the markets have been in trouble for a couple of weeks based on the coronavirus. People have been starting to price in the risk that maybe we're going to get tipped into a global recession by the shutdown that's happened in manufacturing and travel around the world because of this virus. Then the OPEC thing comes along, and one investor that we spoke to this morning described it as throwing a grenade into a bloodbath. So this is great if you like mixed metaphors, I suppose, but what it means is that you're adding an extremely uncertain situation into an extremely uncertain situation, and the impact on markets has been pretty horrible today.
Now, the Saudis have done this before, to lower the oil price, flood the market with cheap oil, hoping that demand would pick up.
Yeah.
And they end up with a bigger market share. That calculation may not work this time.
Yeah, so if you want to look on the bright side, you could say, look, we've had a 30% drop in oil first thing this morning. It was about 20% down by the time I left the office.
Which is staggering, isn't it, in one day?
Which is staggering, and this is a huge gift to consumers of oil the world over. If you want to look at it that way, you could say, look, this is a great stimulus into the global economy.
Except we're not driving anywhere or flying anywhere at the moment. Yeah.
That's the thing. And it's a bit like the help that central banks have been trying to throw into the system. The Federal Reserve in the US cut interest rates last week, which we weren't expecting. Again, it's difficult for that to help if there isn't the demand there for travel and general economic activity.
So the fact that the Saudis and the Russians have been playing this war, this game over oil, does that make the recession that much worse?
Well, what people are worrying about in markets is we've seen stock markets drop very heavily, as your report was just saying. We've also seen stress in the high-yield bond market in the States. So there's lots of quite small energy companies in the US, shale oil producers. This is exactly who Russia is going after. And they've borrowed lots of money for their exploration and all the rest of it. They're going to find that debt very difficult to pay back with oil trading at these sorts of levels. And that's a worry about the domino effect of what could happen through corporate America.
Because the big problem, as far as I can understand, is that corporate debt, the amount of money that companies have borrowed has gone from 3 trillion in 2007 to 6 trillion now. It's a huge mountain of debt. Yeah. If they can't pay that, service that debt, what happens to the economy?
Well, people have been warning for months that the US high-yield debt market is an accident waiting to happen, that there's loads of companies out there that have massively loaded up on debt while it's been cheap, and it would only take a little trigger to push them over the edge. This is the trigger. So that market was particularly fierce again today.
So to be absolutely clear, we are heading for a global recession, yes or no?
That's not fair.
You know everything. Come on. Give us your best punt. Yeah.
The market certainly thinks so. If you look at the US government bond markets, that's definitely what people are pricing in now.
And the kind of falls that we saw today, is that a slump or a crash?
It's definitely crash territory. The oil price move was the worst since the first Gulf War in 1991. This has not been a normal day in the office. And even by the standards of the past couple of weeks, which have taken a few years off my life, frankly, it's been pretty tough.
And as we heard from Siobhan, there's only so much that central banks can do to fix this. Explain that briefly.
That's the big concern. Central banks have cut interest rates absolutely to the floor since the great financial crisis of 2008. There really isn't very much room to cut them further. So if anyone's expecting them to come in as the cavalry, that's a difficult calculation. There could be more coordination between them that might help, but it's not easy.
Katie Martin, thank you very much indeed. John.
So now here, Boris Johnson says the UK is making extensive preparations to move into the delay phase of the plan to contain the spread of the coronavirus, trying to push the peak number of cases into the summer when the NHS is better able to cope. Speaking alongside the Prime Minister, the government's chief medical advisor warned that soon cases of the virus would spread really quite fast, quote, at which point anyone with even a minor fever may have to self-isolate afterwards for 7 days. A 5th death from the virus was confirmed in the last hour. Our health and social care correspondent, Victoria MacDonald, has this report.
From a school in Rugby to a worker at Transport for London to 2 people in Wolverhampton, new cases of COVID-19 confirmed today. And then this afternoon, the death was announced of a patient at the Royal Wolverhampton Hospital and another at Epsom and St Helier University Hospitals Trust, both in their 70s, both with underlying conditions. A statement made to emphasise that although highly contagious, the risk of death from COVID-19 is far higher in older people with other serious health problems. Today, the Emergency Cobra Committee met and confirmed that the country remains in the containment phase, but the Chief Medical Officer issued a stark warning.
We are now very close to the time, probably within the next 10 to 14 days, when the modelling would imply we should move to a situation where we say everybody who has even minor respiratory tract infections or a fever should be self-isolating for 7 days afterwards. And this is going to be the next step. We have not yet reached that step, but we are going to be reaching that step in the really quite near future.
But in the meantime, the NHS will be doing this.
At the moment, we are screening everybody who's in intensive care for coronavirus if they have symptoms that are compatible with coronavirus, so if they have a very bad pneumonia, and we'll be extending that out now, as from tomorrow, to everybody who has a significant enough pneumonia or other respiratory tract infection to get into hospital at all.
A blurring of the already fine line between preparing and scaring, with this warning from the Prime Minister.
Watching what is happening around the world, our scientists think containment is extremely unlikely to work on its own, and that is why we are making extensive preparations for a move to the delay phase. We're preparing various actions to slow the spread of this disease in order to reduce the strain it places on the NHS.
The 4 phases, as we are coming to know well, are contain, delay, research and mitigate.
So the concern I think that all of us have is really essentially what our Italian colleagues have found in terms of large numbers of patients who need access to medical care. Clearly the NHS is gearing up and there are lots of plans going on, and we as general practice are gearing up for that. But we only have a limited capacity, and obviously we are concerned also to make sure our staff stay well, because obviously we potentially could become a patient ourselves.
Delay could mean more home working, or as a last resort closing schools and cancelling large public events. Indeed, in Dublin, where they've had 21 cases, they have already taken the decision to cancel the St Patrick's Day parade. But in England, for horse racing fans, the bets are still on for the Cheltenham Festival.
Speculation about cancelling or postponing sporting events is very premature. We're nowhere near that sort of stage. And if we were to do so, I just add the caveat, there is a possibility it could happen, but we're very clear at the moment that that is not the case.
They have been confined to their cabins since Thursday, and at least 21 cases of COVID-19 have been confirmed. Life on board the Grand Princess has undoubtedly palled. Tonight, though, the Foreign Office announced that the British nationals will be flown from the United States, landing in the UK on Wednesday afternoon.
Victoria MacDonald reporting now. A huge, therefore, challenge for the government, balancing the need for action with the right timing. Our political editor, Gary Gibbon, is in Downing Street. Gary.
Well, as you heard from Victoria there, the advice is going to change pretty soon, suggesting that you stay at home even if your symptoms don't look like full-blown coronavirus. And that's because we're going to move to a situation soon, the medical experts are absolutely clear about that, where there will be a higher possibility, percentage chance that you've got it, because it's going to be around that much more. In that press conference, we also learned that there's been a mini sort of U-turn from the Prime Minister on the whole issue of should you shake hands. He sounded almost blasé about that at the last press conference. Today he's saying that actually the behavioural evidence is that if you avoid shaking hands, it makes you more mindful about the other things you should be doing in this health crisis. The scientists are still saying that there's a minimal risk attached to shaking hands, but it did sound like a bit of movement there. But underpinning everything in that press conference, I think, was a sense in the government that they had to explain to people out there that even though we're at the same stage as some countries were with this virus now, that these other countries have been at earlier, we're not doing the same things that they did. And they wanted to reassure people that that is not because we're slack or behind the curve, it is because of conscious decisions being made in here. And quietly, when you talk to officials away from the press conference cameras, they say they think some of these other countries have got it a bit wrong, that some of the behaviours they're trying to get in place now will actually slacken because people will lose concentration, stop making the effort and start sort of, if you tell them to stay at home and stop going to meetings or whatever it is too early, they'll slip back into their bad old ways. Other stuff that we've learnt today, conversations going on with the supermarkets to try and see if they can do more deliveries. They're stopped from doing it at the moment by lots of bylaws at antisocial hours that might wake up people who live near supermarkets. That the supermarkets say they need to do to make sure there's stuff on the shelves. There could also be some developments to try and make sure that old people who aren't comfortable doing internet shopping but are trying to stay at home, maybe they can phone in their orders to supermarkets. The dog that didn't bark in that press conference today really was the financial figures that Siobhan was talking about. Shocking figures. You'd normally expect them to dominate an appearance from the Prime Minister. They will have an impact on the months ahead. They are not built into the assumptions on which Wednesday's budget is based. But boy, will they impact the world it rolls out into in the months ahead.
Gary Gibbon in Downing Street.
Well, there are now more than 110,000 cases of COVID-19 around the world, according to Johns Hopkins University. There have been more than 3,800 deaths globally. More than 62,000 people have reportedly recovered from the virus. In China and South Korea, the outbreak is showing signs of slowing down. Qatar has temporarily barred travellers from 14 countries in an attempt to stop the spread. In the United States, the Grand Princess cruise ship is expected to dock in Oakland, California, in a matter of minutes. 21 people on board have tested positive for the virus. France has banned gatherings of more than 1,000, while prison riots have broken out all over Italy after visitor access was restricted. Italy has almost 10,000 cases, making it the second worst affected after China, with 463 deaths. Prime Minister Conte channeled Churchill today when he said that his country was facing its darkest hour. A glimpse of the medical front line of Europe's worst affected nation. An intensive care unit in a Cremona hospital inside the exclusion zone of Lombardy. Some of the patients are older, but not all. There simply aren't enough respirators for all those who need them, and doctors are choosing to give them to the patients most likely to survive.
The situation is serious, not in all the north of Italy, but in certain city and in a certain region. In that region, we have to have a difficult choice because the one most likely to survive go first.
Panic has spread to one kind of place where people are already isolated by law. Prisoners on the roof at the San Vittore jail in Milan. Here and in 26 other prisons around the country, the inmates have been protesting everything from inadequate care to limited visits from relatives. In Milan, they ended up burning down the prison. You can hear the mayhem inside. In Modena, prisoners have raided the infirmary looking for methadone. 6 have died, it was announced today by the police, from an overdose. In Rome, family members of the inmates took on the police and demanded better care for those inside. In some places, social order is breaking down. In others, it has been turned upside down. You can still get your nails done in this Rome salon, but not before you've had your temperature taken. You can still attend the Prime Minister's press conference, but the chairs have been placed a metre apart. What's the point of that precaution after the information of the lockdown leaked, allowing thousands of people to escape the quarantine zone? In a matter of days, much of Italy has become Wuhan, but without the discipline and the collective control. Venice, which invented the word quarantine, is now a ghost town. Ski resorts are empty and silent. Economic activity everywhere in the north has virtually ground to a halt. The measures imposed by the government are draconian, but will they work, and are they coming here? Well, we're joined now via the internet by Pasquale Ferrante, who's a professor of microbiology and virology at the University of Milan's Medical School. He's advising on treatments for those who've been hospitalized with the disease throughout the Lombardy region. Thanks for coming on the program, Professor.
Thank you.
Oh, good. Good to have you. Let me ask you, first of all, about this information that we've received from a number of sources, that in Italian hospitals in Lombardy, you're basically choosing to give respirators only to patients who have a chance of survival. And that means a lot of the older patients are being left to die, effectively.
No, this is not at the moment any official position or decision. Any hospital at the moment is trying to treat all the people. We are in the middle of this severe epidemic, and really probably in these days we are facing the huge increase of cases. You can believe just the number are just telling us that the problem is growing a lot. In 3 days, we passed from 3,000 patients to 9,000 just in the last 3 days.
I know these are terrible numbers, Professor, but I just wonder, even though it's not official policy to turn some of the older people away, is that what is actually happening in the hospitals?
I don't know the situation in the old hospital, but I know that many of the hospitals that I am personally in contact, they don't use this kind of attitude. We should for sure. We have a big challenge for the health system. Milano is a town with very big hospitals and is one of the better organized health system of Italy. But nevertheless, we are facing the problems because many of these patients that are affected from coronavirus, they need to go in an intensive care unit or in a good care traditional hospitals.
Right. Do you actually, sorry to interrupt, can I just ask you quickly, do you actually have the facilities, the capabilities of dealing with this enormous increase in the number of patients?
At the moment, in these days, we still have, and the region of Lombardy did organize yesterday, just deliberate a new organization of the hospital. Practically, any kind of classical disease, let's say usual disease that are still important, of course, will be cured, will be treated in a few hospitals, and the rest of the hospitals will be devoted to treat the coronavirus patients. So the number of beds, the number of facilities in this way should be increased and probably capable of treat everybody.
Okay.
Of course, yeah.
All right, I'm afraid we've got to leave it there. Professor Ferrante, good luck and thank you very much for joining us. John.
Okay, thank you. Bye-bye.
Iran's health ministry has updated the number of people who've died there to 237, but there are fears that the total may be much higher. Doctors have told this programme the hospitals are struggling, and prisoners say they are in grave danger. From Tehran's Evin prison, the British-Iranian man Anousheh Ashouri has asked Boris Johnson for help. He did so in a call to his wife in London this morning. Here's our international editor, Lindsay Hilson.
They may be disinfecting the airports, but that's little comfort to most Iranians as their government struggles and fails to contain the virus. Some prisoners have been temporarily released to avoid infection, but not dual nationals. The most well-known is Nazanin Zaghari-Ratcliffe, but there are others.
Hello, my name is Anousheh Ashouri, and I'm calling from Hall 12, Wing 7 of Evin Prison. I wish to inform the international community, and in particular the head of the British government, Mr. Boris Johnson, that all of us in this prison, including the British nationals, are highly exposed to the dangers of contracting the coronavirus. The The officers at Evin Prison are intentionally refraining from providing us with such basic necessities as masks, gloves, and disinfectants.
Mr. Ashuri, who's been in prison for 2.5 years, was talking to his wife and pleading for help from the British Prime Minister. He says vagrants and drug addicts, some of whom are suspected to have the virus, have recently arrived.
Should anything happen to the British citizens imprisoned in Iran, I hold you, Mr. Boris Johnson, personally responsible for your inaction, and their blood will also be on your hands.
Mr. Ashuri's wife believes that the British government can use this desperate moment to press Iran harder.
They haven't even tested them. I mean, a few nights ago, a guard came to their door, put his head in and said, "Does anybody have corona in here?" And they, everybody said no, and the guy left. So this is the extent of the measures provided by the Iranian authorities. So I think if the British government absolutely demands from the Iranians, what guarantees can you give us that our nationals will be safe in view of this spread, which they obviously can't. So, up until now, it's been a matter of just incarceration, but now it's gone beyond that. It's transcended that. It's now life and death.
Prisoners are in danger, so too medical staff. This ambulance isn't going to rescue a patient, it's carrying the body of a doctor. Health workers don't have enough protective gear, and dozens are reported to have contracted the virus. The staff are in mourning and shock, but daren't speak publicly, so we're hiding this doctor's identity. He's now out of the country.
The doctors in rural areas, one of them told me that in one night 10 people passed away in the hospital just due to coronavirus. And now there's a punishment for doctors leaving their shifts, and doctors, some of them actually did leave their shift because, well, some of them are afraid they're going to get the coronavirus. There's a sentence to jail, and that's, I think, is 2 years for leaving your shift.
In some parts of Iran, they're conducting temperature checks, but Iranians are sceptical. Few believe government statistics, and many fear that the outbreak is out of control.
Lindsay Hilson reporting. Well, now with me is Gail Smith. She's a former head of the American Government Development Agency, USAID, where she coordinated the response to global health threats during President Obama's term in office. She now leads the One campaign against preventable disease. Also joined from South London by Dr. Natalie McDermott, a specialist in infectious diseases from King's College London. And Natalie McDermott, why do you imagine that the government hasn't stepped up to the next level on this? Because perhaps they're simply not ready for it, or because it's not necessary?
Well, John, because at the moment it isn't necessary, and in part it's about making sensible decisions at the right time and bringing them in at the right stage. At the moment it isn't felt necessary for us to start cancelling public gatherings and so on, and that's a key feature of the delay phase. So I don't think that they feel it's necessary to do that yet, because if we start doing that now, it could go on for a prolonged period, and we don't want people to become exhausted by those measures and to start to disobey what the government's requesting. It's much better that we bring them in a strategic fashion at a time when it is definitely required, so that the public aren't generally exhausted by the measures putting in place on them.
There's a degree of debate about testing and whether you could test people earlier. Is it a fact, as I was actually told myself when I came back to Iran, that you can't test somebody if they don't have any symptoms? Or is it that actually we just don't have the capacity to test people earlier?
Well, no, actually, you can test people if they don't have symptoms. The problem is that if that test is negative, it's not a reassuring result, because the test looks for the presence of virus in the back of the throat. And if you don't have symptoms, that might be because you aren't infected, or it might be just that the presence of virus is at a very low level, that it isn't yet detectable by the test. So if you tested someone and the result was negative, they would still need to self-isolate for 14 days to clear that period, and they would probably need further tests during that time. So it's not that there isn't the capacity to do that. The capacity is there if required, but it's that we would still be requiring people to self-isolate for 14 days. So is testing really of benefit unless someone has symptoms that is suggestive that they may well have coronavirus?
Flights are still coming into British airports from affected areas, and people are confused that there isn't more of an effort to test everybody coming from anywhere where there has been an outbreak. Is it sensible simply to allow people to drift through the airports?
Well, it's not possible to test people as they're transiting through an airport. Whilst the sample could be sent, it will take several hours for that result to be available. So that wouldn't necessarily help people who are just transiting through an airport. I think that the best policy is what the government has implemented so far, which is to advise people to self-isolate at home and to contact 111 if they've come from a highly affected area or a quarantined area and they don't even have symptoms. And at that point, then 111 can get in contact with them and they can choose to test them, or they can choose to observe them for that 14-day period and implement a test if they develop symptoms.
This next stage that the government's been talking about, which you've explained why there is a bit of a delay because it's not actually needed at the moment, but what will it look like?
Well, the delay phase is simply introducing additional measures to try and prevent the spread of the virus in the UK population. So it doesn't remove the implementation of measures that we have put in place in containment, but it just adds to them by potentially stopping certain events in certain regions of the country that could involve mass public gatherings. So if an area of the UK is particularly badly affected and there looks like there's high levels of spread of the virus, then the government will do a risk assessment and they may decide that certain sporting events or public gatherings should be postponed for a period of time. They may also decide that schools in that region should be closed for a period of time, just to try and reduce the risk of the virus spreading amongst the population.
Dr. Natalie McDermott, thank you very much indeed for joining us. Gail Smith, what's interesting about you is that you had to do this with Ebola. You had to fight the very immediate early stages, 2015?
2014, yes.
2014, 2015. And I'm just wondering, given that experience, looking across the world, where are we in comparison with what was eventually a successful containment of Ebola?
I think we are practicing some of the lessons from that. I mean, I think our two big takeaways from the Ebola epidemic is the first and most important thing is facts. Now, this is happening in real time, so we don't know everything today. We will know more tomorrow, but the more we can rely on scientists to take the knowledge and data we have, model it, and give us guidance based on what they know. There's nothing more important than this than facts and guidance for the public. The second is that viruses like these are the great equalizers. They don't pay attention to borders. They don't pay attention to political parties, affiliation, or anything else. And so there's got to be a degree of collaboration across borders to share information, best practices, and an effort to wipe out the virus.
Now, of course, you were working for President Obama.
Yes.
How do you feel Mr. Trump is dealing with this?
I think Mr. Trump would be well advised to focus on the facts and rely on some extremely talented scientists and medical experts in the US government who, again, based on the facts, can provide public guidance and every day are taking the new knowledge, not just from the United States, from scientists across the world. What we need right now is factual information for the public.
And when we look at the United States, you don't really have what we understand as a public health system, i.e. free consultation right across the system, because you're basically founded on private health. So is that a huge disadvantage to fighting this disease?
I think it may well prove to be a challenge, and as you may know, our health system has been the matter of significant public debate for quite some years, and I expect will be into the future. We're clearly going to have to take steps to ensure that testing, therapeutics as they become available, a vaccine when that is available, which is a ways down the road, are made available to people, because again, you can't pick and choose who is tested or treated. These viruses do not pay any attention to who has insurance and who doesn't.
And very briefly, are you optimistic or pessimistic about this outbreak? Or perhaps you can't afford to be either.
Well, I'm not sure that you can afford to be either, but I also know that we have the information we need to know how to address a threat like this, and we will see more in the future. It's information, it's collaboration, it's transparency.
Gail Smith, I'm very grateful to you for coming in.
Thank
Thanks
you so
very
much.